Trigeminal neuralgia is one of the most common craniofacial pain syndromes, manifesting itself like pain of paroxysmal attacks of electric shocks in one or more trigeminal nerve branches. Percutaneous balloon compression of the gathering ganglion is a minimally invasive, safe and effective technique, which has been used as an alternative treatment when pharmacological treatments have failed. Percutaneous balloon compression is routinely performed under the guidance of C-arm imaging, and the patient is generally hospitalized for more than 2 days. With the advancement of medical imaging technology, 3D CT guidance is used for interventional treatment, which is more intuitive and clear than two-dimensional imaging technique. The rapid growth of daycare surgeries in recent years owes a great deal to the improvement of medical technology. In these years, to strengthen quality management and improve service efficiency, the Department of Pain Management of Beijing Tiantan Hospital, China, has started performing a new procedure called percutaneous balloon compression half-day surgery for the treatment of trigeminal neuralgia, which is under general anesthesia and guided by 3D CT.
Unsuccessful puncture during percutaneous balloon compression surgery, for example, incorrect needle placement or repeated attempts, may give rise to rare but serious complications, such as carotid cavernous fistula, dural arteriovenous fistula, intracranial hematoma, cerebrospinal fluid rhinorrhea, central nervous system infection, cranial nerve injury, or even death on patients. Here we introduce a safer and more efficient 3D CT-guided percutaneous balloon compression procedure. The patient is placed in supine position with their head centered on a CT scanning bed. Blood pressure, heart rate, electrocardiography, and pulse oximetry are continuously monitored. The procedure is performed under general anesthesia with laryngeal mask airway ventilation.
The entry point was located approximately 2.5 cm lateral to the commissure of the lips, and the other two reference points were 3 cm anterior to the external auditory meatus along the zygomatic arch, 1 cm inferior to the pupil. Based on the surgeon's clinical experience, the needle was advanced less than 7 cm, where the tip reached near the basal part of the mid-cresal fossa.
Then, CT scan was performed and three-dimensional reconstruction of the CT images was visualized on a post-processing workstation to determine the exact location of the needle and the foramen ovale. The position of the needle was adjusted according to its spatial relationship with the foramen ovale until it is verified by a subsequent CT scan that the needle had entered the foramen ovale.
After the stellate was withdrawn, a disposable balloon catheter was inserted into the needle and then into the Michael's cave using a guide wire. The guide wire was removed, and 0.3 to 0.5 milliliter of non-ohmic contrast agent was slowly injected into the balloon catheter to inflate the balloon. Another CT scan was performed, and 3D images were reconstructed to check the position and shape of the balloon. The balloon appears to form the shape appear when positioned correctly into the foramen ovale.
After visual confirmation that the balloon was correctly positioned, a total of 0.3 to 0.8 mm of contrast agent was injected to compress the nerve. The compression lasted for approximately 1.5 to 3 minutes, depending on the operator's surgical experience, after which the balloon was drained and removed along with the needle.
The puncture point was compressed to stop bleeding, after which sterile dressing was applied and anesthesia was stopped. Having the LMA removed, the patients were sent for post-anesthesia care.
The Department of Pain Management of Beijing Tiantan Hospital in China has been performing this CT-guided percutaneous balloon compression half-day surgery for the treatment of trigeminal neuralgia since 2017. Firstly, three-dimensional CT scans are very helpful in validating and correcting needle position during percutaneous balloon compression. Percutaneous balloon compression involves the cannulation of foramen ovale, which requires clinicians to overcome a challenging learning curve. Three-dimensional visualizations reconstructed from the scene of images acquired by CT scans provide intuitive, clear, and accurate observations of the spatial relationship between the needle and the targeted foramen ovale. Quantitative distances and angles can also be measured. None of these benefits can be obtained during the two-dimensional images provided by C-arm imaging, which involves repeated adjustment of the scanning arm and multi-angle two-dimensional scans. Consequently, physicians are able to adjust the needle swiftly and accurately with CT guidance, thereby saving time. Additionally, three-dimensional CT scans contribute to improving patient safety, avoiding intraoperative complication and serious post-operative complications that result in hospitalization. Beyond all of these benefits, three-dimensional CT scans also helps ensure a swift patient discharging time, which is a necessity to achieve half-day surgery. Moreover, conventional percutaneous balloon compression are C-arm guided, during which the doctors are exposed to harmful radiation. Three-dimensional CT guidance uses a semi-real-time guidance technique. Therefore, another advantage of this procedure is that the clinicians have no risk of radiation exposure. Furthermore, due to the significant shortening of total surgical time and a corresponding reduction in anesthesia time, the accumulation of narcotic drugs can be avoided and quick recovery from anesthesia can be achieved.
Previously, surgeries of this kind were performed with endotracheal intubation, which have now been modified to perform with laryngeal mask airway ventilation. This benefits patients from anesthesia without the risk of invasive intubation. Finally, sudden onset trigeminal cardiac reflex (TCR) could be avoided by intraoperative medications and hemodynamic stability throughout the procedure. It ensures patients' safety and rapid post-operative recovery through ERAS, enhanced recovery after surgery, which is paramount in modern medicine. The patients can be discharged on the same day after just a few hours of post-operative observation.
Our standardized management procedure not only includes OPD visits before admission, smooth surgical treatment, and immediate post-operative observation, but also includes post-operative consultation and evaluation through telephone and video calls to ensure the effectiveness of post-operative management. Since our patients come from various places in China, to guarantee proper management and care after discharge, our post-operative management team is in constant contact with the patients for consult service through various social media outlets such as WeChat.
The concept of half-day surgery is to admit patient, perform surgery, and discharge patient within a half working day. Half-day surgery can dramatically shorten patients' hospital stay, reduce patients' waiting time before treatment, speed up bed turnover rate, make the most of resource, and improve efficiency of medical care. It is an efficient, rapid medical service model used for improving satisfaction of patients' medical experience and takes a positive and significant role in maintaining a harmonious doctor-patient relationship.
Day surgery is a patient-centered diagnosis and treatment method differentiated from outpatient and inpatient model, acting as a complementary to the traditional medical model. It is also an embodiment of the development of biopsychosocial medical model, which can satisfy the patient's needs of a rapid and convenient medical service, and therefore offers a wide prospect for development. We recommend the viewers to read our study published in Pain Research and Management titled Comparison of Effectiveness and Safety between Intraoperative 3D CT Guided and C-arm Guided Percutaneous Balloon Compression for Idiopathic Trigeminal Neuralgia, a multi-center retrospective study.